All right, to conclude on this discussion is Dr. Abdul Ali, Deputy Medical Coordinator, MSF. Doctor, thank you so much for joining us on Insights.
Thank you.
Thank you. Now tell us, what efforts has your organization been making to ensure that the prevalence of Noma is reduced to the barest in Africa and Nigeria?
MSF has been in Sokoto supporting Noma Children's Hospital to treat the patients, as well as work together with communities for awareness and early detection of cases, and so that they are identified in the early stage of the disease and referred to the hospital for treatment. We do have community work. We work community. We work to make the communities aware of what is Noma and how is it prevented, and then the treatment. We understand that Noma is a preventable disease, and in this regard we work through our outreach teams to reach to the community and work together with the community, educate them, and provide the needed support in this regard.
Okay, so are there challenges you face trying to meet up with the target of a particular project in reducing the prevalence, the burden on patients and their parents or family members? Are there challenges you face?
Of course, Noma is not a disease of one causing factor. It has multi-dimensional factors. Okay. It has it needs like a multi-factorial response as well. It's not only a disease of a microbacterium, but there are several other risk factors. In order to respond and treat this disease or eradicate this disease, we need to respond from different dimensions, from different factors, including nutrition. Nutrition is very prevalent in those patients who are getting Noma, and as well as the vaccination coverage. These are the two main factors that need to be responded and that need to be provided to the communities, so that they, other factors are the hygienes and their environmental factors that affect the Noma patients. There are several challenges. Some, unawareness of the communities about the disease. Sometimes the disease is so rapidly progressive that it takes just few weeks to reach to very dangerous stage. So for this reason, the awareness of the communities is so important, so that they directly seek the treatment, the care, other than going to traditional healers, where the treatment is delayed a lot, and then when they reach to us in a very advanced stage, where the treatment of those patients become very difficult.
Okay. Now, since you have been working with the Sokoto State government, I would like to ask you this. What is the level of response like? If you are to assess the level of response from the Nigerian government to addressing this particular disease, how would you rate the response?
For example, malnutrition is very prevalent in the area. So in order to treat and effectively respond to Noma disease, you need to work for nutrition as well. Vaccination coverage is very low in those areas, because some people, there is very low acceptance of vaccination in the area. So those are the areas where we need to work more on the vaccination coverage, nutrition, and most importantly, awareness of the communities about the disease and its preventing factors and the risk factors associated with this disease.
Okay, now let's talk about the WHO, World Health Organization's roadmap 2021 to 2030 on neglected tropical diseases. Now, Noma is one of them. Do you see us using the targets of this roadmap to see to the fact that Noma and other tropical neglected tropical diseases can be eliminated before 2030? Is that feasible?
I think it needs like more collaborative efforts from different organizations, educating communities, the awareness, vaccination coverage, nutrition. In this stage, even in the well-educated communities, let's say in the medical practitioners, the knowledge about Noma is very limited. So that is the work being done. Since this disease has come in the NTD, the neglected tropical disease list, the attention to this disease has increased. But I am very optimistic that much work can be done in this regard to at least have more people know about the disease, about the risk factors that is communicated with the community, and the community is empowered and the community know about the disease, how to prevent, and then if some people and some children they get the disease, how to treat, and they seek the appropriate health facility.
Okay, all right. Now let's talk about Europe. What exactly is that continent doing that the African continent is not doing?
There are some risk factors associated with this disease. It is not only a disease of one cause. It has several. Low vaccination coverage is one of that. Malnutrition is another of that causes. So I don't see, I mean, like these are the most probable causes that if you compare Africa or especially Nigeria with European societies, as well as the vaccination coverage. And other hygiene practices, for example, or the oral hygiene practices that is more correlated, that's more related to also poverty and access to hygiene material, for example. So these might be the causes, but there might be several other causes, but I can say these few of them.
Okay, so in reducing the prevalence of Noma disease in Nigeria, what is the role of the primary health care?
I think we see significant role of the primary health care in this regard, because primary health care is provided in the communities, and so the first role is educating the communities.
Okay.
Yeah. The second one is access to health care. These are the two major things that can be that I can say that the primary health care can have a very significant role in it. Once the first point of the patient or the caretaker is the primary health care where they can reach. And then if some patients they need secondary health care or even tertiary health care, they can be referred, they can be sent to other secondary health care hospitals.
Dr. Abdul Ali, Deputy Medical Coordinator, MSF, I want to thank you for joining us on Insight, and thank you for your thoughts on our focus. Thank you very much.
Thank you very much.
Whatever the issues are,
the National Assembly is constitutionally empowered to scrutinize,
however complex or intricate, We have involved all the academia, the members of the academia. We have involved the academies.
Be it government's policies or in fact any issue of public concern,
our job is to help you gain clarity and make sense of it all.
This is not really healthy for our democracy.
There's a lot of aggrievance in terms of who has been in power longest and who becomes the governor of the state.
It's also in the quality of food being consumed.
After all, perception is insight.
and gaining understanding is also getting insight.